Good morning, everybody. Welcome. Welcome to this webinar on prevention and early diagnosis of cancer. Today kicks off the European Week Against Cancer. And to mark this occasion, Cancer Patients Europe is organising a series of webinars, each of which will tackle a different aspect of the challenges of cancer. My name is Tamsin Rose, and I have the great pleasure of being your moderator for the webinars every single day this week. Let me just give you a few practical pieces of information. The hashtags that we're going to invite you to use include hashtag reducing cancer inequalities and hashtag EWAC 2024. That's European Week Against Cancer, EWAC 2024. This webinar is being recorded, so you can watch it again or share it with friends and colleagues, and you'll find it on the Cancer Patients Europe YouTube channel. Throughout our session, you can engage with us through the Q&A function on Zoom. And a little bit later in the webinar, I'll be opening the floor to your questions, and we'll get through as many questions as we have time for. But I would like to start, we're going to start just to get us warmed up this morning on a Monday morning, to start with a good question. We've got a trivia quiz and I've got a question for you. So let's launch that first question. And we have a question we'd like to ask you. Where were the oldest descriptions of cancer found? So we're in the ancient world here now. Was it in ancient Greece, where of course Hippocrates, and the sort of early beginnings of some medicine? Was it ancient Rome? Do you think it was ancient Egypt or even Mesopotamia? So you can vote now. You submit your vote and we'll start to see the results in real time. This is just a trivia quiz to get us started on a Monday morning. Where were the oldest descriptions of cancer found? Of course, it's been with the human race for a very long time. So where would we see the first descriptions of cancer being written about? And I can see our votes coming in now, and we've got so far ancient Egypt is moving ahead. More than half of you believe that's where it was. A quarter think actually no, it's Mesopotamia. Some people think it was ancient Greece, and many people think that ancient Rome, being more recent than all the others, was actually the place where it was first described. We've had 23 votes in so far. Let me give you the answer. We should believe in the wisdom of crowds today, because the correct answer is ancient Egypt. And more than half of you identified that. Now, that's a sign that for almost as long as the human race has been recording its history, our communities have experienced cancer. So the question that we face today, looking at prevention and early diagnosis, is also a question that's been with us for a long time. To just set the scene for us and start us understanding the context, I'd like to introduce my first speaker, and that's Dr. Thomas Hofmacher, who is the research director at the Swedish Institute for Health Economics, the IHE, and they have recently put out a report highlighting cancer inequalities. So please, the floor is yours.
Thank you so much, Tamsin, and good morning, everyone. It's a pleasure to be here with you today. So indeed, earlier this year, me and my colleague Andreas Pousset, we published a report called Tackling Inequalities in Cancer Care in the European Union. And it was really, a follow-up report based on the positive developments that we saw on the European level since the publication of Europe's Speeding Cancer Plan in 2021, and also the launch of the European Cancer Inequalities Registry in 2022. And I think what we tried to do in the report is really to highlight, first of all, some inequalities between member states. And we took a very simplistic perspective. As health economists, we looked at differences in outcomes, because we wanted to see what do countries actually achieve in cancer care. And if you look at the survival rates, which we used as the primary outcome of cancer care, we saw that there are huge differences. We have around 50% survival rate in colorectal cancer care in member states like Croatia, Slovakia, Romania, Bulgaria, Poland, whereas in member states like Belgium, Finland, Sweden, Germany, we have a 70% survival rate. So 50% in some member states, 70% in other member states. Those are the outcomes. What can explain that? Well, we looked at the inputs, and a very simplistic input is just looking at how much member states spend on cancer care. And there we see, again, huge differences, with Romania spending the lowest, around 70 euros per capita on cancer care. And then countries like Germany, Austria, the Benelux countries spending 4 times more, 250 euros and more on cancer care. But we also saw that there are the Nordic countries, for instance, that spend less than the German-speaking countries and the Benelux countries, but they still achieve good results. So money is not everything. It might explain some part of the equation, but not everything. So what we actually did in the report, we looked at was to look at the cancer care pathway and across all the 4 pillars covered by Europe's Speeding Cancer Plan, to really try to pin down some inequalities between member states. So for instance, today we're talking about prevention, early diagnosis. For prevention, we looked at HPV vaccination, and we saw that member states have been including the HPV vaccination in their vaccination programs for children. But we see that only Portugal previously used to achieve a vaccination rate of above 90% for girls. Now, Sweden just joined Portugal last year, but then there are countries like Bulgaria where only 10% of girls are vaccinated. For early detection, we saw that we looked specifically at colorectal cancer screening. We saw that in Cyprus, Bulgaria, Romania, only 5%, around 5% of people are participating in any sort of screening activities, or at least doing it on their own, because in most of these countries, actually, there are no organized screening programs yet for colorectal cancer. And at the other side of the spectrum, we have Denmark with a 76% participation rate in colorectal cancer screening. And the list continues when we look at other areas in cancer care. We looked at biomarker testing and the adoption of NGS technology. In the area of treatment, we looked at to what extent member states are actually using new cancer medicines. And in the area of survivorship, we looked whether countries have adopted the right to be forgotten to facilitate access to financial services for cancer survivors. And apart from all of this between country inequalities, we looked also at within country inequalities. And again, this is where I think the European Cancer Inequalities Registry is a rich source. And it demonstrates that there are big within country inequalities in the area of prevention. Again, the HPV vaccine, there's still some countries where boys are not included in the HPV vaccination program. Bulgaria, it will change in 2025, and the other country is Estonia. But we also see that the vaccination rates in boys are lower, for instance. There are also inequalities when it comes to age, when it comes to education levels, socioeconomic status, and where people live, so urban versus rural areas. And there are many reasons. That's the other part that we looked at. What are the reasons for all of these inequalities? And I think within countries, it's really health literacy aspects. So it's the education level, socioeconomic status, geographic distances to treatment facilities that play a role. But between countries, I think it's about political prioritization. It's about funding. It's about providing adequate infrastructure, having enough medical professionals, and also updating clinical guidelines. So there are actually many reasons for why we see inequalities between countries, but also within countries. I'm going to stop here and I'm going to look forward to the discussion. Thank you.
Thank you very much. I think that was a very helpful short overview of some of the different inequalities that we can see. And I know you'll be able to answer questions from the audience later when we get to the Q&A section. So thank you very much. Let me introduce, I have a panel who are going to share their perspectives on that. So welcome to Enrique Terol, who is the Spanish Health Attaché here in Brussels, representing the Spanish government. Caroline Bercher, the health economist at the OECD Health Division, and Jacqueline Daly, a patient advocate and co-founder of the East Galway and Midlands Cancer Support Centre. And I'm going to be asking each of them a specific question, and then I'll be opening the floor to your questions. So now is the time to start submitting them via the Q&A. Thank you, by the way, to Vladislava, who's asked a question, say, could we provide the web link to the report that Thomas has just spoken about? After this webinar, we'll send you a follow-up email, and you'll get in there web links to various documents, including to the IHE report and also to the EU Semester Manifesto that I'll be touching on later by CPE. So thank you for that. We'll make sure in the follow-up email that you will get all of those links. Thank you. Right, so before I ask my panel to answer my questions, I would like to get a sense from you. I have a poll that I'd like to ask you, and what I'd like you to think about, given what we've just heard from Thomas about, some of the reasons for the inequalities and some of the potential ways they could be tackled, what actions are necessary to reduce inequalities in cancer prevention and diagnosis in the EU? So we're going to open that poll now. And you can pick two. We've given you 5 potential options for actions, and you can pick 2. So if you think that it's all about access, and maybe because Thomas mentioned the rural urban divide or lack of professionals, you're going to be clicking there. If you think it's about public awareness and education, remember again, Thomas talked about literacy, health literacy, and there's very low take up of the options for prevention and screening, you're going to click there. Funding and resources. Now, remember, Thomas said it's not just about funding, because some countries don't spend that much but still get good outcomes. But if you think we still need to invest, because he did highlight that amongst things to do, you're going to click on funding and resources. If you think it's all about political priorities, you're going to select the policy implementation and resources. If you think it's about research and data collection, we need to measure better, we need to see what's happening, we need to understand, that's what you're going to be answering. So I'm looking now, and we've had responses from some of you, and the number one message that's coming through is it's about access to healthcare, and it's about policy implementation and enforcement. So I'll just give it another minute or two for you to be able to respond, but our panelists are going to look at that and also reflect on how they see us being able to address this effectively. But clearly 46% of the vote so far, it's about policy implementation and enforcement. It's about the political priorities that Thomas mentioned, and therefore putting the correct funding in place, making sure that we've got access and public information campaigns. So you, the audience, are telling us it's all about policy implementation and enforcement. So thank you very much. I think we'll close that vote now, and I've taken it that it's the policy implementation and enforcement that's number 1, and access to healthcare services is number 2. Thank you. Right. So panel, Enrique, let me invite you to reflect on. We've heard from Thomas, setting out the overall report, but from your perspective, sitting in a member state government and sitting in the council, what do you see as the biggest inequality across and within the EU member states in reference to cancer?
Hello, good morning to everyone. Thank you, Tasmin, for the question. I mean, as presented by Thomas, I think that it's clear now that depending on what we are addressing in cancer, we are having different risk factors that are responsible of the, let's say, bad results or good results. In the case of prevention and early detection, I will say that it's a combination of factors, of course, but social, economical status and health literacy, I would say that it's the major factor of inequality now. And why? Why? Because it's clear from all the data that people with lower socioeconomic status or health literacy is having 2 to 3 times the risk of having a bad habit, let's say. Tobacco is the first one, that's clear. 50% of the cancer deaths among men are related with this type of modifiable risk. So definitely how we tackle the differences in socioeconomic situation, health literacy, and awareness of the population is the key factor to avoid the first stage of this path of cancer. So prevention and early detection is clearly related with this factor. How to do it? As I said, it's a mix of variables. One is, of course, the political priority of the member state. Second, but not only in addressing cancer, also related with how to educate population, promote healthy habits, etc., etc.
Thank you very much, Enrique, for giving us that perspective and again highlighting literacy and education as being, one of the key issues that could make a difference both in people's individual behaviours and lifestyle factors, but also their take-up of what's available in terms of prevention support and therefore access to early diagnosis. Let me now invite Caroline from the perspective from the OECD. We hear that politicians want to do something about inequalities. We're now starting to understand that they're quite dramatic. So what is proven to work in reducing health inequalities in cancer?
Thank you. Good morning, everyone. It's a pleasure to be there. So as you know, the OECD, jointly with the European Commission, developed a big report to provide guidance and policy options to reduce inequalities in cancer burden and cancer prevention. So in this report, we show that policymakers have a lot to do to reduce inequalities, and this makes echo to Thomas and Enrique presentation. But let me just focus on one policy option, which is to invest in prevention policies to address cancer risk factors, which, as just said, are more prevalent among vulnerable population. So my first point is that countries should implement a comprehensive prevention policy package, which includes legal and fiscal policies, but also intervention in the primary healthcare settings, in schools, and also in the workplace. These are very important interventions, as no one measure will make a substantial impact on its own. It's also really important to remind policymakers that investing in healthy lifestyles and environment not only saves money for the healthcare system by reducing cancer burden and related inequalities, but it's also key to boost the economy because it keeps workers productive. And this is also an important point, for the economy and the society as a whole. So at the OECD, the modeling work that is done by the public health team shows that for the alcohol risk factors, combining established policy intervention such as alcohol taxation, regulation of alcohol advertising, and also alcohol counseling in primary healthcare setting would reduce alcohol-related cancer cases in 48 countries by 2 million by 2050. So this is a large impact. Another key example is from France on addressing tobacco cancer risk factors. So the country has implemented a full package of policy with its 2016-2020 tobacco control intervention. And again, our modeling work at the OECD shows that between 2023 and 2050, these combined interventions are expected to prevent 4 million cases of chronic disease, including cancer. So again, a big impact and a large investment from a policy, a comprehensive package of policy. My second point, which makes echo from what has been said previously, relate to health literacy. So for vulnerable people to lead a healthy lifestyle and in a healthy environment, they should have good level of health knowledge and understanding. So policymakers need to address the gaps in health literacy between population groups. So we know from the data that is collected at EU level that half of the population in European countries have inadequate or problematic level of health literacy. And again, the proportion are larger among vulnerable, so low education, low income group, but also migrant population. So we need to develop, for example, health education materials in partnership with the target population. We need to make sure that intervention are done in co-creation process, make sure that the communities are involved in this intervention and in the design of the policies. And my last point relates to the role of healthcare system. It contributes to reduce inequalities. So again, we should include, the primary healthcare, but also we need to develop new service delivery model to ensure that the recommended preventive services are delivered to the population groups with lower socioeconomic status because they are far from the health system. So we show in the report that it can involve, role of pharmacists. It can involve the development of mobile screening unit, for example, or allowing for self-sampling. These are all interventions that have been found to be effective in reducing inequalities. Thank you. Over to you.
Thank you very much again for highlighting some of the key messages, and also when governments do what our audience has said is the number one thing to do. The message was policy implementation and enforcement, and you've set out some clear measures when governments make a political commitment. So, for example, on tobacco control, on alcohol consumption, we get a real impact in lives saved, we get an impact on better health, and we get an impact on money saved for the economy. So really, it's a win, but governments have to grasp the mettle and really start implementing some of these policies. You also highlighted the importance of, going to where people are, making sure that screening is mobile or accessible, using pharmacies better. They are often the healthcare professional that people see the most. So there's an opportunity to do more, make sure that we promote some of these different services. And I think that speaks to the second priority that our audience had highlighted, which was access to healthcare services. So you talked about new service delivery mechanisms, going close to people and making sure they have access to that. Fantastic. Jacqueline, let me bring you in now. We're in that year of magical musical chairs at EU level. We're about to have European Parliament elections. There'll be a new commission taking office. So what could the next EU mandate do better?
Good morning, everybody. Thank you for the question, Tamsin. I think with the European Parliament elections coming up, I think one of the mandates that I would like to see driven would be to improve access to care and to ensure that it's equitable right across all the member states. And I would like them to support initiatives to reduce the cost of cancer treatment and medications. Again, when it comes to enhancing prevention, we can promote and fund cancer prevention campaigns focusing on lifestyle, such as smoking cessation, healthy diet, regular exercise, and to implement and enforce regulations to reduce our exposure to carcinogens in the environment and in the workplace. I would like to see more harmony around cancer screening programs across the EU to ensure early detection and treatment, and to develop and implement standardized guidelines for cancer screening and early diagnosis. And I also think we need to strengthen and be more proactive in sharing our facilities and sharing analysis and helping to identify trends to inform policy decisions. And if we encourage collaboration between member states on data-driven approaches in cancer control, I think we'll be in a much stronger place.
Excellent. Thank you very much for giving us that key point. We've got a couple of comments or questions that are starting to come in, and now is your opportunity. I've opened the floor for you to put your questions to the panel, and Thomas is also joining us and able to answer questions. We've had a comment that I'd just like our panel to reflect on. Somebody said that digital communication is key in reaching the population. We've talked about health literacy being one of the key challenges, and collaboration with large platforms such as Google to leverage AI could help raising awareness and supporting early disease detection. Does any of the panel want to talk about the potential power or utility of AI and other platforms in perhaps addressing this utility? Anyone from the panel, signal if you'd like to pick up on that. What could AI or digital communication do to tackle some of these literacy? Of course, we have the challenge that we also have digital illiteracy. So that, and it may well be that the same socioeconomic groups who have health illiteracy don't have the same access to digital. Thomas, go ahead.
Yeah, I think Tamsin, actually the last point that you made, I think that one's actually important because, you know, using AI, using digital tools to raise awareness, I think that's great, and it will work for many people. I mean, in my life, I've never actually read a newspaper, like in paper version. I've always just read everything online because I got access to the internet more than 20 years ago. And since then, I mean, there's no news for me to newspapers. So if you want to reach me in terms of awareness campaigns for a newspaper, my generation, it's impossible to do it in the traditional way. You have to use digital tools. But then if you would want to reach my parents who are in the relevant age group for colorectal cancer screening, for instance, my father received his first smartphone earlier this year. Like, he has been probably one of the last persons in Austria to receive a smartphone, but still, he still doesn't know how to use it. So if you would try to reach him with digital ways, it's impossible. You will not be able to reach him. And I think that's something we pointed out in the report, that there are also these inequalities, you know, in terms of socioeconomic status, in terms of age group as well, because it really differs. And I know I'm just speaking out of you know, anecdotal examples here, but it's something important to consider. So to answer the question, yes, I think AI and digital tools are very important for my generation to raise awareness, but it will not work for the older generations, at least not all of the people.
Thank you. Yes, Caroline.
If I can add something, so I completely agree, digital literacy is very important and it's key to improve health literacy. And some countries are working in this direction. So for example, in Netherlands, FAROS, so the Dutch Center for Expertise on Health Disparities, work, you know, in partnership with local government and community to create some, you know, initiative to improve digital literacy in, you know, the overarching objective to improve health literacy for all population groups. And these are very important, you know, initiatives to make sure that, you know, these interventions are adapted to communities' needs. So they develop, for example, some education program with all communities and people to explain, you know, the digital tools that will help to improve health literacy.
Thank you. I'll move on to the next question, if I may. We had a question from Paul Corners, and he said, the spending on cancer care varies 2 to 3-fold without clear evidence of benefit, e.g. Belgium versus Germany, yet outcomes can vary 25% without clear evidence of different spend, e.g. Ireland versus Poland. And this, I think, Thomas, goes back to your first presentation to say it isn't just about where the money's being spent, there's something else happening here. So Paul's question is, what spending does not improve outcomes? In other words, what should we stop spending money on? Because that would free up some cash to reinvest in things that really work. So Caroline and Thomas, with your economics hats on, I'll come to you, and then Enrique, I might invite you to also reflect on, is there a disinvestment strategy where governments are taking a hard look to say, well, what's not good value for money, and how can we shift that to what we really know is working? Tough questions for a Monday morning. Enrique, sorry.
Yes.
I can, okay, go ahead.
Thank you, Caroline. I would say that, I mean, of course, investment is fundamental and political prioritization, but the way you are using the money is fundamental. By instance, in certain groups, and my colleagues, they know that much better than me probably, in certain groups of population, especially older age or people that it's under a screening target, it's fundamental the opportunistic detection. So because their relation with your primary healthcare professional, it's fundamental. It's the person who will, let's say, convince you to do the screening or even to take the screening directly in the health center. Because in some type of population, the screening programs separated from the healthcare provision are not working well. So then we need to put that together, not only public prevention programs separated from the healthcare, but integration of prevention, early detection in primary healthcare.
Thank you very much. So that's a very clear kind of concrete recommendation. Caroline, what do you see that we could do better?
So I think that there are, other factors beyond the spending, of course, that can explain, inequalities, but also performance in cancer care. The main thing, obviously, is the workforce and the medical equipment, that are in the countries and how they are used. That in some countries, they face a clear workforce shortages, and this is one main issue that can lower performance of countries. Beyond, workforce and equipment, there are also key other levers that explain differences in performance. So I would say care practices, but also the quality governance. So national plans, setting out targets, guideline for care and means for monitoring progress, accreditation, professional licensing. These are all, critical factors that explain performance and, inequalities across within countries.
Thank you. Thomas.
Yeah, a quick one. I think also to turn this question around a little bit, I think some countries maybe don't need to spend as much as Germany and Austria. Like the Nordic countries, and I'm taking the example now of Sweden and Austria, my two favorite countries. So in Sweden, in breast cancer screening, we have an 80% participation rate in our population. It's the highest in Europe. Austria has a participation rate of around 42%. So 80% in Sweden, 40% in Austria. That will lead to a bigger proportion of breast cancer cases being detected early in Sweden compared to Austria. And we know that treating an early stage breast cancer, especially stage 1, compared to stage 4, is around 5 to 9 times cheaper. 5 to 9 times cheaper. So Sweden doesn't need to spend as much on breast cancer care as Austria because they're catching many cases early. So there's no need for spending that much. And I think that's something also important to remember in this discussion.
Thank you very much. I think that links back to what Enrique has said, which is if we're integrating screening much more centrally in our primary healthcare, opportunistically if it falls outside the area where you normally do screening, but really heavily pushing screening in our primary healthcare, we would catch people earlier, we would treat them earlier, and of course that's the focus of today's webinar, is early prevention and looking to see how we can do that. So it would save money and be more cost effective. We heard from Caroline the issue of workforce shortages, and I would guess from all the data I've seen, all countries in Europe are facing workforce shortages, some more so critical than others, but this is a key issue. We need to update our medical equipment, but also care practices, guidelines and governance. So this comes back to what we asked the audience, and the message came back at the beginning, it's policy implementation and enforcement, and that's just been reinforced by everything you've said, that political decisions matter. And if we get the policy decisions right and we enforce them, then there would be benefits for tackling inequalities, there would be benefits for earlier diagnosis, better uptake of screening, etc. Thomas, your report sets out some of this evidence, and I know Caroline, the OECD also sets out, best buys, good governance for countries. If this stuff is so clear, why don't we get the uptake?
Well, I think the question should not be addressed to me and Caroline. I think both of our institutions, we provide the evidence, and we have great reports that complement each other. So I'm a big fan of the work that the OECD does. But I think what we have in common is we just give the recommendations. We provide an analysis of the current status quo. But I think then it's for the countries, for the member states, for Enrique maybe actually to take this question.
Thank you. Enrique, you're in the hot seat. Why don't we do what clearly is being advised?
I would say that, a comprehensive policy on cancer is fundamental, as was stated, because it's not only one measure. It's the sum of many different measures. And for instance, first one is regulatory. Okay, we know all of us are aware, and the OECD data and all the data are clear that tobacco is the first cause, preventable cause of cancer. 25% of all cancer are related with tobacco. So then why we are not more drastically regulating tobacco? Because we are still in a phase where we are having, of course, everyone is following the legislation in the European Union, but at national level, there are still policies that needs to be implemented. For instance, free environment tobacco places. So it's completely unacceptable that currently we are having a passive smoker cancer incidence as we are having now. And that implies, of course, having something that we didn't mention here, which is the elephant in the room, is how to tackle the tobacco industry and also the alcohol industry. In the sense that even for tobacco, it's clear, everyone has a common view, but in alcohol, it's not so clear. In alcohol, we are having still many elements like labeling, controlling the sell to young people, etc., that's still pending to be. And that has to be embedded in the policy on cancer as the first element, the first step. And then we need to, of course, to invest in all the other steps like prevention, early detection, screening, etc., etc. And there are measures that are very clear. For example, having a screening, having vaccination of girls with HIV vaccine, it works very well. And you can see the countries, as was mentioned by Thomas, that countries that were establishing these programs in a consistent way, they are being successful. They are being successful. So there's no doubt about this. And now with boys, we will start with boys. So then probably we need to learn from your reports, Thomas, Caroline, and really identify where should be the places where we should put the money. And I would say that prevention and early detection is fundamental, much more than possibly any other actions together.
Thank you. We're going to perhaps squeeze in one last question from the audience. And we've had a question from Roxana, and she's saying, what's the plan in Europe to assess new technologies that could make screening more efficient and better early detection? And if we are looking at that, how would these technologies reach less advantaged communities or countries? So is anyone able to help us understand, is there a priority in looking to see what new technologies are out there just to get screening more accessible, more present in people's lives? We talk about self-screening. Can anyone comment on that briefly, please? Jacqueline, if you got your hand up?
Yeah. Yes, I would like to see more collaboration between member states where we standardize screening. And, I think by doing that, by learning from each other, it can actually make it a little bit cheaper for the countries that don't have the money to invest. And just to step back, even with smoking cessation, we'll see in all of the we see it in schoolyards now all the time, vaping, which is a huge problem right across Europe. But I do think that if we standardize all of our like self-sampling, all of that, and collaboration, we will make a huge difference.
Thank you very much. Do any of the other panelists want to also reflect on this? Are there new technologies, new tools that would get screening, make it more efficient, more accessible, particularly for communities? Let's talk about maybe the rural and the city divide, people in lower socioeconomic groups who perhaps, are not going to be responding to a message to just come in for screening. Anyone like to pick up on that?
Maybe I can add, on the importance of better reaching population in remote or vulnerable, area via expanded access of screening. So again, I will repeat the important role of pharmacists in screening. So it's done in some countries, it's developing. Mobile screening unit in France, it has been shown to reduce inequalities between vulnerable areas and more, developed areas. So across EU countries, it's developed in about a third of the 27 countries. So it's not a lot. Self-sampling also, it's important. So for now, only 7 countries use it for HPV testing. So again, you know, it's still in the early stage, but I think these are all important innovation that will improve, you know, access to screening program for, you know, the most vulnerable people.
Thank you very much. We are coming towards the end of our time, and we have had a couple of more questions that we haven't had a chance to answer, but we will share these questions with our speakers, and if possible, in the follow-up email that we send to all of you who've joined us live this morning, we will send additional comments if our speakers are willing to respond to that. I'm going to now conclude our conversation with a call to action. As I mentioned earlier, this is the year of change. We're about to have elections and a changeover of the EU mandate, and they will be looking to decide what's our priority for the next 5 years. The current mandate had cancer as a very strong priority, and we saw that in a number of different ways, including the European Beating Cancer Plan. What we'd like to invite you to reflect on is what could the next mandate do? And I'm going to invite you to think about the EU Semester Manifesto put together by CPE, and you will find that in the links that we send to you. And there is a specific call in there that says, we call for the integration of comprehensive cancer prevention and early detection indicators into the EU health policy making process, using an enhanced equality registry and a dedicated European dashboard to effectively monitor and address disparities across member states. So the point here we're making is that it is all about policy implementation and enforcement. As you, the audience, voted earlier in the webinar, we said, what action should be taken? And the number one message came through as, you know, policy implementation enforcement. Choices that we make now about how we invest and what we do for our healthcare systems really matter. They make a difference in health outcomes and for our population health. So this is our call to action. I want to say a warm thank you on the behalf of our participants to our speakers, to Thomas, to Enrique, to Caroline, and to Jacqueline. Thank you for joining us all first thing on a Monday morning. Please join us again tomorrow at the same time, and our focus will be on innovative diagnostics and accurate diagnosis. Thank you all, and see you soon.